welcome to English News Bulletin of Hallabol. Before moving to the details, let us have a look at the headlines. Tripura government to file an affidavit before the Supreme Court as it feels Solicitor General of the central government has wrongly told that Tripura government did not pay salaries to the doctors and healthcare workers. Tripura MLA Dhananjay Tripura found COVID positive according to antigen test conducted on Saturday. COVID patient revealed ugly, dirty, unhygienic atmosphere of Bhagat Singh COVID Care Centre. Tripura's Royal Sky and Pradyut Debarman demanded alteration of lyrics in the Indian national anthem. Now the news in details. Salaries of health workers are paid on due date, said Law Minister Rotul Nalnath at a press meet on Saturday. The BJP-led Tripura government would file an affidavit before the Supreme Court as it feels the Solicitor General of the central government has wrongly told the Apex Court that the state government did not pay salaries to the doctors and other healthcare workers on time. An official release of the Tripura government said on Saturday that with reference to a writ petition, the Solicitor General of the central government told that the Supreme Court that 5 states, Delhi, Maharashtra, Punjab, Tripura and Karnataka have not paid salaries to the doctors and health workers on time to their full satisfaction. However, amidst a press release of Saturday, Law Minister Rotul Nalnath said the Tripura government has been paying full salary to the health workers, including doctors, on due date every month. It is further asserted that not only health workers but full salaries of all employees of the state government have been paid on due date without any deduction.
সাথে যুক্ত যেসব চিকিৎসক এবং স্বাস্থ্যকর্মী রয়েছে তারা যেন রেগুলার স্যালারি পায় এবং সে নির্দেশ পেয়ে আমরা আগের থেকেই স্বাস্থ্যকর্মী চিকিৎসক যারা রয়েছে তাদেরকে আমরা নিয়মিত বেতন প্রদান করছি। শুধু এটা নয়, কোভিড-19 সাথে যুক্ত যারা চিকিৎসক নার্স তাদেরকে 10,000 টাকা করে আমরা ইনসেন্টিভ দিচ্ছি। এছাড়াও যারা আশাকর্মী আছে তাদেরকে অনারেরিয়াম 1,000 টাকা প্রতি মাসে দিচ্ছি।
It is clarified that all health workers and doctors who are quarantined in Tripura, whether in an institution or at home, as per the requirements of their duty, their period of quarantine is treated as on duty. Further, full cost of their fooding, lodging and medical attention during the period of institutional quarantine is being paid by the government of Tripura. The official release said the observations were made by the top court bench during the hearing of the writ petition seeking timely payment of salaries to frontline COVID-19 warriors and doctors. The center had informed the top court that it has written to the states, but some of them have not replied. Bureau Report, Hallabol. One more Tripura MLA got infected with coronavirus. This time, Raima Valley constituency MLA Dhananjay Tripura tested positive with the virus when he went through rapid antigen test at Gondachora Subdivisional Hospital. After MLA Rampodo Jamatia, one more Tripura MLA got COVID infected. This time, MLA Dhananjay Tripura found positive to the COVID-19 virus. According to information, Saturday, Raima Valley constituency MLA Dhananjay Tripura came to Gondachora Subdivisional Hospital for treatment as he was suffering with fever, cough and cold. Gondachora Hospital Medical Officer Dr. Jatileshwar Debarma treated MLA Dhananjay Tripura. In the emergency unit of the hospital, MLA Dhananjay Tripura went through rapid antigen test wherein he tested positive to the coronavirus. This triggered huge resentment in the hospital premises. Also, the people who came in contact with MLA Dhananjay Tripura were tested for the virus, following which one co-worker was also found affected with the virus. At around 7 p.m. in the evening, they both were brought to the Nirmahal at Melaghar via an ambulance. However, the news of COVID-19 infection in MLA Dhananjay Tripura and his co-worker triggered a tensed situation in the whole subdivision. Bureau Report, Hallabol. The health department in Tripura is in doldrums under the BJP government's era. Episodial complaints have come up against the mismanagement and poor facilities in the COVID care centers. Also, the central government's guidelines are not followed in the Tripura COVID care centers. The central government of India has issued a guideline on what benefits patients admitted to a COVID care center will get, and many states are providing various facilities for COVID-19 patients. The question has arisen as to why the measures are not being taken in Tripura till now. According to information, the guidelines of COVID care center are the first to say that as soon as corona infected patients come to the corona care center, he or she must receive a welcome kit. This should include a bucket, mug, towel, brush, pen, toothpaste, paper or notebook, etc. New patients should be given new pillow covers and new bed sheets too. Everyone should have electronic reactor, kettle, as it is important that the patients can drink hot tea or water. It is also clearly given that each patient must be given the food of their own choice at least once a day. But the question in medical community of Tripura is why this policy is not followed in Tripura. According to the expert doctors of Tripura, if the guidelines are implemented in the state, the patients undergoing treatment in the COVID care centers would recover very quickly and would be able to stay mentally fit while undergoing treatment. The health department in the state is in doldrums under the BJP government's era, with no health minister to look after the health department in the crucial time of COVID pandemic. The patients and common man are the only sufferers. Since the onset of COVID-19 in Tripura, a number of allegations have come up on the mismanagement and facilities of the COVID care centers. The physically affected COVID patients been infected with the deadly virus are left in the COVID centers to face severe hardships. The patients have episodically complained on the poor quality food, lack of proper drinking water, garbage-filled surroundings and many more. Even they have complained on the poor treatment, saying that no doctor or healthcare staffs even come to know their condition of health. Saturday, a video on social media Facebook account got viral, which showed the pathetic scenario of Bhagat Singh COVID Care Center. Rituparna Bhattacharjee of Agartala went to IGM hospital following severe pain as she was 7 months pregnant. There, on conducting COVID-19 test, she was declared positive to the virus in the test results. Soon, she was taken to the Bhagat Singh COVID Care Center at around 1 p.m. at night. But there, she was kept waited for 4 long hours in an ambulance as the doors of the COVID care center were locked and were all asleep. While sharing the live video over Facebook at around 2 p.m. on Saturday afternoon, Rituparna broke down into tears while showing the filthy, dirty surroundings inside the wards of COVID care center. The toilets were in terrible condition and the wards filled with the waste and dirt along with rotten food. She said only having a strong mindset won't help. Anyone coming to the COVID care center will lose strength, seeing the pathetic condition and dirty atmosphere. She raised questions while saying, how can a normal human being stay amidst such a mess, mainly while she is 7 months pregnant?
একটা হবে তখন আমি আইজিএমে যাই, আমার পেন ওঠে, তখন আমি আইজিএমে যাই, ওখানে আমাকে টেস্ট করিয়ে আমাকে এখানে পাঠানো হয়। তখন ভেবেছিলাম হয়তো এখানের অবস্থা ভালো, আমি ভালো থাকবো, কিন্তু এত খারাপ অবস্থা আমার জানা ছিল না। এখানে 4 তলাতে উঠে নেমে নিজের কাজ, হ্যাঁ অবশ্যই করোনা পেশেন্ট নিজের কাজ নিজেই করবে, এটাই স্বাভাবিক ব্যাপার, কিন্তু আমি এখন যে পরিস্থিতিতে আছি, আমি হয়তো যদি আমার সন্তানের চিন্তা না করতাম বা সন্তান না থাকতো তাহলে হয়তো এই অবস্থাটা হতো না। কিন্তু এখন যেহেতু সে আমার মধ্যে আছে, আমার তার চিন্তা করতেই হচ্ছে। আমি জাস্ট লাইভ করলাম, কিন্তু লাইভে আসার আগেও আমি যখন এখানে আসি আমাকে 4 ঘন্টা অ্যাম্বুলেন্সে বসিয়ে রাখা হয়। ওরা ঘুমোচ্ছিল, কেউ ওরা খুলছিল না। একটা প্রেগনেন্সি মহিলার জন্য 4 ঘন্টা এক জায়গাতে বসে থাকা খুব কষ্টকর। এখানে যারা আমার লাইভ দেখছেন তারা হয়তো জানেন যে কি অবস্থায় একটা পেশেন্ট থাকে। আমার কোত্থেকে করোনা হলো, কি হলো আমি জানি না। এই অবস্থাতে আমার বাড়ির লোকের পজিটিভ না হলে ওরা এখানে আসতে পারছে না, খুব স্বাভাবিক। মনের জোর নিয়ে এখানে এসেছিলাম আমি, কিন্তু আমার সেই মনের জোরটা এখানে নেই। আবারও দেখাচ্ছি এভাবে একটা মানুষ কি করে থাকতে পারে আমার জানা নেই। কারণ করোনা ভাইরাস যেইভাবে ছড়াচ্ছে, আজকে আমার হয়েছে, ঈশ্বর না করুক আর কারো না হোক, সবাই ভালো থাকুক, কিন্তু করোনাতে আমার এক ফোঁটাও কষ্ট হচ্ছে না। আমার মনে হচ্ছে আমি ভালো হয়ে যাব, কিন্তু এইভাবে একটা পরিস্থিতিতে একটা পেশেন্ট থাকতে পারে না। হাত জোর করে রিকোয়েস্ট করছি, কেউ যদি পারেন তাহলে আমার কথাটা শুনে অন্তত প্রশাসনকে একটু বলুন।
She further requested everyone to share the video as much as possible so that the health department can be made aware of the filthy situation in the COVID care center. Rituparna also added, being 7 months pregnant, she was not given any food till 2 p.m. in the afternoon and expressed concern about the baby growing inside her. Bureau Report, Hallabol. The proposal of Tripura's royal scion Pradyut Debbarman over amending the Indian national anthem has raised severe controversy among the major sections of the people. Tripura royal scion Pradyut Kishore Debbarman demanded that the national anthem of the country, Jana Gana Mana, should include all non-represented regions and communities of the country, considering the changing socio-political landscape. Debbarman said Indian constitution was amended not less than 124 times in the last 71 years of its existence, as and when situation demanded for the interest of the country. But national anthem has not yet been amended, even for a single time, though only 4 regions are reflected in the song. Jana Gana Mana, considered as one of the important instruments of the national integration and symbol of unity and integrity. The Indian national anthem, composed by Nobel laureate Rabindranath Tagore, consists of the names of cities Punjab, Sindh, now in Pakistan, Gujarat, Maratha, Dravid, all 4 states of South India, Utkal, Orissa and Banga, Bengal. Pradyut argued that there are many other states and union territories that does not find mentioned in the national anthem, but that doesn't mean that they are outside India or they lack identity. Nobel laureate poet Rabindranath Tagore had a close relation with the princely state of Tripura, and its 4 successive rulers forms an important chapter in the state's history. His friendly relation reflects in his book Rajashri, Visarjan and Mukut. Rabindranath composed the Indian national anthem in the year 1911, when Sindh was a part of undivided India. It was first sung on December 28th. Pradyut Debbarman's argument on amendment of Indian national anthem has raised a number of questions in the minds of common man. His idea of changing the national anthem is not clear to many, as Pradyut did not mention what is to be replaced or added after the change. Also, people are saying who would be able to make alterations in the song composed by Kavi Guru Rabindranath Tagore. Also, comments have been heard among the major section of people saying, when Pradyut Debbarman's father Kirit Debbarman and mother Bibhu Kumari Devi served as the Indian National Congress as member of parliament, but they did not ever come up with any such gesture. Overall, it can be concluded that the proposal of amending the Indian national anthem made by Pradyut Debbarman is not comprehensible to many. When the demand of Pradyut Debbarman to amend the Indian national anthem got viral over various media platforms, Pradyut in turn slammed back the media, accusing them that Tripura journalists are jobless, which is why they have made it an issue, also adding that they do not do their homework. Bureau Report, Hallabol. Priyanka Gandhi Vadra, AICC General Secretary, attacked the Yogi Adityanath government in UP over nil law and order situation in the state. All India Congress Committee General Secretary Priyanka Gandhi Vadra attacked the Yogi Adityanath government in Uttar Pradesh over the issue of rising crime, alleging Jungle Raj was growing in the state, but no action was being taken in this regard. The Congress General Secretary has been attacking the Uttar Pradesh government over law and order and has slammed the state government over the Vikas Dubey incident as well as the killing of Ghaziabad-based journalist Vikram Joshi, who was shot in the head by some assailants. Has the UP chief stopped watching the news? Do these reports not go before the people sitting in the Home Department? Priyanka Gandhi wrote in a tweet in Hindi. New records of Gunda Raj are being set in Uttar Pradesh. There has been a kidnapping incident in the Chief Minister's hometown and a massacre in Kasganj. She tweeted tagging news reports on the two incidents of crime. Priyanka Gandhi hit at the BJP government saying there is no rule of law in Uttar Pradesh. Every now and then there are reports of numerous crimes from the state and the perpetrators are being backed by the members of ruling BJP government. UP recorded the maximum number of crimes in the country according to the NCRB 2018 and there is absolutely no fear of law. She added, from common man to policeman, no one is safe in the state where complete anarchy is going on. Also, the justice delivery system in Uttar Pradesh is the worst among the country today. Priyanka Gandhi Vadra also wrote a letter to the Chief Minister Adityanath urging him to fix the law and order situation in UP. Bureau Report, Hallabol. Well, that's all from our English desk at this moment. For more news and updates, stay tuned to Hallabol.